welcome back to another episode of PT Talk. I'm Matt Carpenter, your host of the show. Today we're going to be talking about Lyme's disease. Now, when you think about Lyme's disease, what's the first thing that comes into your head? Ticks, right? But what exactly is Lyme's disease? Lyme's comes from a bacteria called Borrelia myoni. This bacteria is found in ticks and is transmitted to people when the tick bites them. It takes about 72 hours for the disease to be transferred from the tick to a person. After the bacteria enters the host, symptoms start to show. These symptoms include fever, fatigue, muscle and joint pain, and the telltale sign is a red bullseye rash known as erythema migrans. As physical therapists, we are in a unique situation when it comes to the diagnosis of Lyme's disease, especially in the direct access field. We are key in identifying when the patient's symptoms are in line with Lyme's disease. If you practice in a heavily wooded area, this is even more important. If you suspect a patient has Lyme's disease, immediately refer them to their primary care doctor. It is important that they get on antibiotics right away to prevent further complications. But what else can we do to help? The most important thing to do is provide patients with education on how to properly check themselves for ticks.
Every time you come inside from a heavily wooded area, it is important to conduct a tick check. Remove your shoes and socks first and begin to search yourself from head to toe for small moving black dots. Ticks range in size, from barely visible to the eye to the size of a large freckle. If the tick is big enough, you might just feel it walking on you. It tickles. The earlier you check, the less likely the tick will have found a spot to bite down. Ticks will continue to walk around until they find a place they like that has smooth skin and lots of blood. Scalps, back of the necks, armpits, etc. If you need an extra pair of eyes, have someone you trust help you with your tick check. If you find a tick on you, it is advised to still be careful. It is quite hard to kill a tick. If you do find one, try flushing it down the toilet.
Thank you for tuning in to today's episode of PT Talk. To suggest a topic for next week, text MattCarp307 to 22333 and give your suggestion for next week's topic. I'll see you next time.